Another barrier to access is being broken down in the push to protect children against COVID-19. The province says vaccination clinics will soon be opening in schools across Ontario, allowing students to roll up their sleeves during school hours. And this is something Toronto is leading the way on.
And so we've been doing this. We're now just continuing to scale it up.
For about 6 weeks now, the City of Toronto has been running hundreds of school-based clinics, allowing students to get immunized with a simple consent form. This map shows how the approach can bring vaccine equity to some of the hardest hit neighborhoods.
One of the pillars of our campaign was accessible clinics. And so we started in the first week in late November running school-based clinics. In fact, we've run 250 school-based clinics already, and we have 42 clinics planned in the next couple of weeks. The results are impressive. I mean, the more accessible you make clinics, the more likely people are to get their shots.
And other regions will be following suit. The Ministry of Education has directed public health units and school boards across the province to launch these clinics as another point of access. Peel Region's top doctor says plans are already in the works.
We are looking at piloting it in accordance with the Ministry of Education and Ministry of Health with in-person schooling now returning and within school hours. Consent is being directed through a provincially created form by the Ministry of Education.
Dr. Lowe says COVID vaccines are the best protection against severe illness. Over the last 2 weeks, 70 COVID positive children under the age of 4 have been admitted to hospitals in Ontario. Data shows these young unvaccinated kids are being hospitalized at a higher rate than any other age group. While it's still unknown how many of those cases are considered incidental, the Children's Hospital of Eastern Ontario tells CityNews in just 7 weeks they have had 43 COVID admissions. That's almost half the total number of children hospitalized over the course of the entire pandemic.
Oh, what a great guy.
And the vaccination rate has significantly slowed in the youngest eligible population, with about 50% of kids between the ages of 5 and 11 with one dose. Councillor Cressy acknowledges the uphill battle, saying vaccine accessibility is critical, but only goes so far.
The same neighborhoods where we've had more clinics also have the lower vaccine rates still. And so what that really shows you is that if we're going to move from 51% to 60 or 70 or 80% uptake, we're going to have to host many more clinics, but we're also going to have to really do focused hyperlocal outreach to those parents who continue to have concerns.
Now, these school-based clinics are being organized by public health units. More information will be available in the coming days and weeks. Shauna Hunt, City News.